The history of urology is a fascinating page of discoveries. Kidney tumors are no exception. For centuries, these tumors remained hidden, sometimes discovered only during autopsies. Early physicians had limited tools and knowledge to diagnose these tumors while the patient was still alive. The development of the microscope in the 19th century marked a turning point. For the first time, doctors were able to examine the cellular structure of tumors, leading to the precise identification of different types of kidney tumors. The 20th century witnessed remarkable advances in imaging techniques. The advent of X-rays, followed by ultrasound, kinetic scans, and MRIs, revolutionized our ability to visualize and diagnose kidney tumors in detail. These technologies allowed doctors to see the internal structure of the body without surgery, leading to earlier detection and more accurate diagnoses. Today, we stand on the shoulders of these pioneers, equipped with even more sophisticated imaging modalities and a deeper understanding of the disease. As our understanding of kidney tumors progressed, so did treatment options. Early surgical attempts were risky and often fatal. However, the development of anesthesia and sterile techniques in the late 19th and early 20th centuries paved the way for safer and more effective surgical procedures. Over time, surgical techniques were perfected, aiming to minimize complications and improve surgical results in patients. The introduction of minimally invasive surgery in recent times has further revolutionized the field, allowing for smaller incisions, shorter recovery times, and a lower risk of complications. Nowadays, the treatment of renal tumors is a multidisciplinary task involving urologists, oncologists, radiologists, pathologists, and specialized nurses. This collaborative approach ensures that patients receive comprehensive care tailored to their individual needs. As we continue to unravel the complexities of kidney tumors, we can look forward to even more effective treatments and better outcomes for patients in the years to come, providing them with a better quality of life. Kidney tumors, also known as renal cell carcinomas, are complex and often arise from a combination of genetic and environmental factors. While the exact causes of kidney tumors are unclear, several risk factors have been identified that may increase a person's likelihood of developing this condition. Understanding these risk factors is important for both prevention and early detection. One of the most important risk factors for kidney tumors is smoking. Tobacco smoke contains numerous carcinogens, harmful substances that can damage DNA and cause the development of kidney cancer. Studies have shown that smokers are at a significantly higher risk of developing kidney tumors compared to non-smokers. The good news is that quitting smoking can significantly reduce this risk over time. Other lifestyle factors also influence the development of kidney tumors. Obesity, for example, is linked to an increased risk of several types of cancer, including kidney cancer. Maintaining a healthy weight through a balanced diet and regular exercise is essential to reducing the risk of this disease. High blood pressure, or hypertension, is another risk factor. Although the exact mechanism is not fully understood, it is thought that high blood pressure may damage kidney blood vessels, increasing the risk of tumor growth. In addition to lifestyle factors, certain genetic entities may predispose people to kidney tumors. Von Hippel-Lindau disease, for example, is a rare genetic disorder that causes tumors to grow in various parts of the body, including the kidneys. People with a family history of kidney tumors or other related cancers may also be at high risk. Genetic testing may be useful in identifying individuals who may benefit from increased surveillance and early detection measures. Kidney tumors are often called silent growths because they frequently develop without any noticeable symptoms, especially in the early stages of the disease. This lack of early warning signs can make diagnosis difficult and delayed. However, as the tumor progresses, it can begin to press on surrounding organs or blood vessels, causing a range of symptoms. Being aware of these potential warning signs is crucial to seeking timely medical attention. One of the most common symptoms of kidney tumors is the presence of blood in the urine, known as hematuria. This blood may be visible to the naked eye, giving the urine a pink, red, or brown color. In many cases, the blood may be microscopic, detectable only by a urinalysis. If you notice any change in the color of your urine, it is essential that you consult a doctor immediately. Another common symptom is pain in the side or back, between the ribs and the hip. This pain is usually dull and persistent, but it can also be sharp and intermittent. Unlike back pain caused by a muscle strain or injury, kidney tumor pain usually does not improve with rest or commonly used pain relievers. If you experience persistent back or side pain that has no obvious cause, it's important to see your doctor for evaluation. Kidney tumors can also produce a range of systemic symptoms, including fatigue, loss of appetite, and unexplained weight loss. These symptoms are nonspecific and can be caused by a variety of diseases, so it is important to consider other possible causes. However, if you experience these symptoms along with other warning signs, such as blood in your urine or persistent pain, it is essential that you see your doctor. One of the first steps in evaluating kidney tumors is a urinalysis. This simple test examines urine for the presence of blood, protein, and other abnormalities that may suggest kidney disease. Although blood in urine can have several causes, its presence warrants further investigation. A complete blood count is another routine blood test that measures the different types of blood cells. Anemia, a low red blood cell count, can be a sign of advanced kidney tumors. Imaging studies play an important role in the diagnosis and staging of renal tumors. Ultrasound is usually the initial imaging test performed. It uses sound waves to create images of the kidneys and can help detect the presence of a tumor. However, ultrasound has limitations in visualizing small tumors or those located inside the kidney. CT scans and MRIs are more sophisticated imaging techniques that provide detailed cross-sectional images of the kidneys and nearby structures. These scans can accurately determine the size and location of the tumor, as well as assess whether it has spread to nearby lymph nodes or other neighboring organs. In some cases, a biopsy may be necessary to confirm the diagnosis. During a biopsy, a small sample of the tumor is removed and examined under a microscope by a pathologist. This helps determine the specific type of kidney tumor and its aggressiveness, which is crucial to guiding treatment decisions. Diagnosis of kidney tumors usually involves a combination of laboratory tests and imaging studies. These tools provide valuable information about the size, location, and possible spread of the tumor. Laboratory tests help evaluate kidney function and look for specific markers that may indicate the presence of cancer. Imaging studies, on the other hand, provide visual representations of the kidneys and surrounding tissues, allowing doctors to identify and characterize any abnormalities. Surgical treatment: radical nephrectomy. Radical nephrectomy remains an effective method for treating primary renal cell carcinoma. By definition, this procedure involves the excision of Gerota's fascia, the kidney itself, and perirenal fat. The objective of this intervention is complete tumor excision with an adequate oncological safety margin and minimal manipulation of the excised tissue to prevent tumor dissemination. Conservative renal surgery. Indications for partial nephrectomy: renal cancer in solitary kidney, bilateral renal cancer, contralateral kidney with decreased function, small peripheral lesion, incidentally detected tumor, preoperative suspicion of non-malignancy, renal cell carcinoma in von Hippel-Lindau disease, unknown status of contralateral kidney. Chemotherapy. A large number of chemotherapeutic agents have been tried without success to date in the treatment of renal cell cancer. However, preliminary studies of the use of 5-fluorouracil in combination with interleukin-2 and interferon alpha have shown response rates of 46%, with 15% complete remissions and moderate systemic toxicity at the doses used. Immunotherapy. The basis of immunotherapy in renal cancer is the unusual natural history of this disease, which includes spontaneous regression, late growth of metastatic lesions, and variable tumor doubling times. All of this suggests that host immune factors may play an important role in controlling the disease. Interferon alpha. Interferons, and interferon alpha in particular, have shown efficacy, around 15% partial remissions, against renal cell carcinoma. But complete remissions are anecdotal, 1% of cases. Patients with the best response rates are those with localized and well-defined metastases, especially in the lungs. The effects of interferon alpha are those derived from the activation of NK cells, the increased expression of tumor-associated antigens, and the modulation of HLA class 1 and 2 antigens. Interleukin-2. T-cell-derived interleukin-2 showed complete remissions in up to 5% of cases and partial remissions in 10 to 15% of cases. Some of the patients had complete responses and have been disease-free for more than 7 years at present, suggesting sustained responses in a small group of patients. If you like our content, give us a like, subscribe, activate the bell and share this video so more people can see it.